Now, labor force trends are quite interesting because, as we can see on a total aggregate level, our labor force within healthcare has gone from, let's say, 2 million people all the way to 2.7, 2.8 million people. And so, if we are sitting today in 2025, then I would expect us to be at, let's say, 3 million healthcare workers across the United States from, let's say, 2 million, 2.3 million in 2010. So 10 years ago, we had a million less people within healthcare than we did today. And so you say, that's great. We have a greater workforce. I would say, yes, that's true. But also, we have a greater demand for more procedures and services within healthcare that has more than doubled for sure. And so what you can see is that even though this trend is upward on a percentage basis, our labor FTEs on a percentage change has really averaged around less than 2% on an annual basis. As you can see, we hover at the top end and increase our labor and FTEs by 3% annually at the very, very high end. At the very low end, we shrink by 2%, and this is normally known as the COVID effect when it comes to labor, to where labor shrunk by 2%, which is quite astounding and did put a large bind on many hospitals and clinics across the United States. But then in 2021, we bounced back to increasing at 3% and made up that gap. What I'm saying is that on an annual basis, at the best case scenario, we can increase our labor within healthcare by 3%, which is quite in line with other industries. But what we're going to see in future pages, is that that 3% may not be efficient or may not suffice in being able to provide the services and procedures and everything else that comes with healthcare to an increasing population. If we look at it on a hospital versus contracted labor basis, hospital labor certainly takes up the larger percentage, to where 97% are from hospitals and the smaller percent are contracted labor. But this contracted labor is a big portion because it fluxes in and out depending on specific years, etc. If we, let's say, nail down to, let's say, 2023, for example, what we'll see is that FTEs were 2.6 million, and then contracted labor was 200,000 roughly. Now, another thing we can see is that hospital FTEs essentially increase generally on an aggregate basis on a negative level. What this means is that hospital FTEs are decreasing while you have more and more reliance on that contract labor to be able to supply any services within your clinic or hospital. And I'm sure that you could see this trend wherever you are within healthcare, where contracted labor that moves from, let's say, hospital to hospital or from area to area is certainly a greater trend. The traveling nurse is certainly one that was very, very popular in 2020 to 2021, but it increasingly is so the case that we are relying on contract labor for healthcare staff within the United States.